As a provider who works in the urgent care, I've been diagnosing and treating a lot of influenza A lately. In fact, I'm currently recovering from influenza A right now. I was diagnosed last week for the first time ever, and so I have some firsthand experience on just how miserable the flu can be. So, in today's video, we're going to talk about how to recognize the flu, when to get tested for the flu, what medications to take to make you feel better, potential complications of the flu, and how to get back to normal as soon as possible. So let's get started. So there are three types of influenza that can affect humans: influenza A, B, and C. So in today's video, I'm going to focus on influenza A because influenza A generally causes the most severe side effects. So what are the common symptoms of the flu? Fever, headaches, body aches, cough, fatigue, sore throat, nasal congestion, and in some cases, GI symptoms like nausea and vomiting. So according to the CDC, the ideal time to get tested is within the first 3 to 4 days of symptom onset. So I would go a step further and say as soon as possible. If you test positive for influenza A within the first 48 hours, your provider is likely going to suggest that you take an antiviral medication. The most common antiviral medication to treat the flu is called oseltamivir, aka Tamiflu. It's a twice-a-day, 5-day treatment that may reduce the duration of the illness and reduce the risk of respiratory tract complications. An alternative antiviral medication is Xofluza. It's a 1-day treatment, which sounds great, but in my personal experience, when I've attempted prescribing this medication for patients, number one, it's pretty expensive. And number two, it's hard to get access to this medication. And oftentimes pharmacies will order the medication on a case-by-case basis. And so patients are delayed and they don't really end up getting their hands on the medication until after that 48-hour mark. So I'm going to tell you guys my personal experience with Tamiflu. I did take it last week. I took the full 5-day course. And I can honestly say that the medication did help the severity of my symptoms. And I'd say that the medication absolutely worked for me. So what are some other things that you can do and some medications that you can take to help yourself feel better? Number one, to help with the headache, the fever, the sore throat, and the body aches, you can take ibuprofen, aka Motrin, or acetaminophen, aka Tylenol, which can be picked up anywhere. I honestly just purchased some from Dollar Tree last week. Something else that you can take to help with the nasal congestion is saline nasal spray. I love saline nasal spray. I swear by it. It'll really help to lubricate and clear out those nasal passages because you are very likely to be congested during this time. Some people do recommend immune boosting supplements like garlic, zinc, and elderberry as well. Rest and fluids are so very important during this time. Your body is at high risk for dehydration, so you want to make sure you're drinking tons of fluid, electrolyte replacement drinks. I personally like the liquid IV packs. When I had the flu last week, I was mixing those in with my water. They taste pretty good and they have multiple flavors, so that's my recommendation. I don't care so much for the Powerade and the Gatorades because they have a lot of sugar, and sugar feeds viruses. They love sugar. So that's another side tip. You want to stay away from sugar, eat really nutritious foods during this time, and keep it bland if you're experiencing nausea, vomiting, and diarrhea. Tea with honey can help to soothe your sore throat, and the rest of your time needs to be spent sleeping, resting, and recovering. So some things to watch out for. So secondary infections can develop from the flu. I personally developed a sinus infection after contracting the flu. Ear infections are also fairly common, and one of the more serious complications from the flu is pneumonia. Other possible serious complications triggered by the flu include inflammation of the heart, the brain or muscle tissue, and even multi-organ failure. So the flu can actually be deadly. So some symptoms that you want to watch out for that would warrant hospitalization are severe dehydration, respiratory distress, impaired cardiopulmonary function, or altered mental status. If you experience any of these, time to go to the hospital. So what are some things that you can do to prevent contracting the flu if you are in the same household as somebody who has the flu? So number one, clean air. Try opening up your windows or running an air purifier. Also, you really want to be making sure that you're wiping down surfaces because the flu can be contracted from touching a surface that has the virus on that surface. So you want to make sure you're doing really great hand washing as well, and wearing a mask if you're going to be exposed to the person who has the flu, because the flu is primarily spread through respiratory droplets that come into contact with mucous membranes. In general, you really want to try to minimize, if possible, your exposure to the individual who has the flu. So I'm going to talk to you guys about my personal experience with the flu last week. So my symptoms started on Monday night when I got home from work. A wave of nausea just swept over my body, and I never really get nauseous. So I knew something was going on, and I suspected the flu because, like I said, I've been exposed to so many patients with influenza A at work. So I went straight to bed, and that next morning when I woke up, I had a pounding headache, and I started to develop a cough. And I was so fatigued, I literally could not move out the bed, not to get tested, not to do anything. So all day, I laid literally in the same spot. I called off work, and I just laid there from sun up to sundown, didn't have an appetite, just felt horrible in general. So that next morning, I said, okay, I got to get up and get tested. So I went to the urgent care, and I tested positive for influenza A. So at that time, I did get prescribed the antiviral medication Tamiflu, which I started right away. I really was staying hydrated. I was taking Motrin for the body aches, the headaches, the sore throat, and taking some of the supplements that I talked to you guys about today. So after about 5 days, I started to feel a whole lot better, but I noticed that I was extremely congested. I was having a lot of sinus pressure. I had very thick green nasal drainage. It was running down the back of my throat, so I had a lot of postnasal drip to the point where I was kind of choking. And so I'm currently on a course of antibiotics for a sinus infection. I don't know if you can hear it in my voice, but after about two to 3 days on this antibiotic, I'm starting to feel a whole lot better. So I think once this passes, I'm going to be in the clear. I pray I'm going to be in the clear. That's unfortunately one of the downsides of working in the urgent care is I'm exposed to so many sick people. So I really have to make sure that I'm getting a whole lot of rest and working on this immune system of mine because it definitely needs a boost. So hopefully you guys learned something from today's video. If you're suffering from the flu, hang in there. I know how it feels. Literally, I know how it feels. You're gonna be fine. Just watch out for some of those red flag symptoms I talked about. Make sure you're really hydrated and resting, and this shall pass. All right, guys, I'll catch you guys in my next video. Thanks for tuning in. Bye.